Okay, this video is, are medical textbooks a joke? And yes, I said they were a joke, and yes, I mean it. They're a joke, and I know exactly what I'm talking about. I graduated first in my medical school class out of 333 students. I had 99% on my boards in medical school and residency, okay? I've studied this stuff for many years extensively. I did a fellowship at Harvard, so I got a lot of experience with everything I'm talking about. Okay, so first of all, they hide the truth about nutrition, estrogenics, and toxicology. Basically, most disease, you know, all the stuff we call chronic disease, almost all of it is caused by poor diet, estrogenic chemicals, and toxins, okay? And doctors are not taught about nutrition, estrogenics, and toxicology. It would be like trying to teach people how to play football but not including the ball. You know, you have to include the ball. That's it, okay? That's the most important stuff to know. They don't know anything about it, okay? Medical students, as a pre-med, they study things that are completely irrelevant to medicine, like calculus, physical chemistry, all this stuff. And they don't learn, you know, you could talk to a fourth-year medical student, you could talk to a senior resident, and they don't know what causes diseases. You always want to learn what causes a disease. Because once you know what causes a disease, you avoid what causes the disease, and you give the patient a chance to get better. But they don't learn what causes the vast majority of diseases. In a sense, they're basically trained to sell drugs, you know, and surgeries and laboratory tests, you know, from blood draws and imaging tests and, you know, semi-invasive diagnostic procedures, colonoscopies and all that, endoscopies. You know, x-rays, CAT scans, MRIs, tons and tons of that. And patients like that, okay? But what I'm trying to say is none of those things cures a patient. You know, you can cure a patient potentially of some things with colonoscopy. You can cauterize a bleeding ulcer, for example. That's good. But the point I'm saying is what they're basically trained is match the ill to the pill and send the bill. I remember finishing up medical school and being really enthusiastic. Wow, this is great. We know all the diseases, we just give this pill and the patient gets better, it's great. But then you get into real medicine, you see that the patients almost never get better. Patients hardly ever get better. And there's no money in that. If a patient were cured and went on their way, you would lose money. You wouldn't get any more money from them. So all these chronic diseases, they're defined as chronic, meaning that they can't be cured. Like diabetes, hypertension, coronary artery disease. But it's a joke, it's ridiculous because you look at the vegan literature, they cure patients all the time. Coronary artery disease, Esselstyn's diet, 198 in a row, cured. You know, hypertension, Richard Moore's, low salt diet, and Kempner. One after another patient, cured, cured, cured. You know, Pritikin said 90% of his patients, same thing with McDougall, just in their brief courses, would be cured and come off their hypertensive medications, okay? So in a sense, they're being trained in this false, outdated system to think that health revolves around taking pills and drugs, okay? It's like the Ptolemaic system of astrology compared to reality. Biochemistry books routinely recommend high-fat diets. I own a bunch of them, and I looked at 3 out of 4 in a row, all recommended high-fat diets. That's absolutely stupid. That's like sending a syphilis patient to the brothel for treatment. It's completely stupid. And then when they go through the inhibitors of metabolic pathways, they'll give you some irrelevant inhibitor that doesn't even matter. They don't tell you stuff you need to know, like glycolysis is inhibited by F-, okay, and arsenic. They don't go through the mitochondrial inhibitors. They'll give you maybe one research-related mitochondrial inhibitor. They don't tell you about, you know, 15 relevant ones. I just gave a lecture on mitochondrial inhibitors that you ought to know about. Okay, things like Tylenol is a mitochondrial inhibitor, and atrazine, common things, trichloroethylene, all right, saturated fat, potentially your statins with, you know, coenzyme Q, all right, that stuff worth knowing. Okay, they don't cover things like, you know, lipid peroxidation with regard to omega-6 fats, and then the toxic aldehydes, hydroxynonenal, the work of Tetsumori Yamashima. Almost nothing clinically useful is covered in these books, okay? They're pathetic. They're a joke. You can't know how to take care of patients. That's why these young doctors don't know how to take care of a patient. All they know is the book says give this drug. Okay, atherosclerosis and coronary artery disease. They just emphasize cholesterol theory. Cholesterol theory is Mickey Mouse compared to atherothrombosis theory. I did a fellowship with emphasis on vascular disease at Harvard, okay? I've been thinking about atherosclerosis for decades, and I can tell you, atherothrombosis theory puts it all together. You need to know that to make sense of atherosclerosis. And the best book ever written on is by Gregory Sloop, MD, pathologist. Pathologists are the best experts of atherosclerosis because they don't care what the treatment is. A cardiologist always has to, in the end, say stents are good. A surgeon has to, in the end, say surgery's good, or it's hard for them to stay in their field. They'll get pushed out probably. Okay, William Roberts, another pathologist, says you look at it under a microscope, atherosclerosis is a blood clot. And cholesterol theory is just a subset of that. You need to know that if you want to make sense of atherosclerosis. They never talk about Walter. These names are not in the books at all. You can get these big Harvard textbooks. I recently read one on cardiovascular physiology, the Harvard textbook. No mention of any of these guys. Walter Kempner and how he cured tons of patients, reversed their EKGs, reversed their problems with their eyes from their diabetes and their hypertension. Okay, Dean Ornish, you know, the vegetarian diet had some reversible coronary artery disease. Caldwell Esselstyn with a complete vegan, low-fat diet had even more prevention. 198 patients in a row cured of no recurrent coronary events in 4 years. July 2014 Family Practice Journal article. Okay, hypertension. The best book by far, there's no comparison, is Richard Moore's High Blood Pressure Solution. It's a masterpiece, a genius work. He devoted his whole career to studying hypertension and especially the ion pumps and the plasma membrane. I got lectures on all these topics here. In particular, his book is the best one, though, on learning about ion pumps and the potassium-sodium ATPase pump and how that runs calcium, cytoplasm calcium concentration control, which is what causes hypertension. You get elevated cytoplasmic calcium in your smooth muscle cells of your arteries, and that makes them constricted. So you have to pump blood through a constricted system that causes hypertension. So you stop eating the sodium, eat more potassium and magnesium vasodilators, you cut the fat, making the blood thick, increasing blood viscosity, and you get dramatic improvements in hypertension, okay? And doctors don't know that, okay? They should know that because it's not in their books, okay? Diabetes, nothing about the Sweeney, Hemsworth, Rabinowitz, Walter Kempner papers, Michael Brownlee's genius paper, Gerald Shulman's genius paper, Roy Taylor's great papers. I've talked to a bunch of diabetic doctors. None of them knows these papers. Not a single one of them. And I've talked to a bunch of them. Okay, they don't know this at all. It's pathetic. They know all the drugs. That's what they get paid to do. They don't. I've never seen anyone recommend a low-fat vegan diet in a medical book. I hear the Mediterranean diet recommended a lot of time, like the clowns out in Boston. Okay, taking care of the chronic traumatic encephalopathy brain patients. Tell them to eat a Mediterranean diet, which is toxic to the brain. Totally stupid. Okay. Okay. Let's see, autoimmune disease. There'll be nothing about leaky gut. You'll read chapters in the Harvard textbook of pathophysiology. There'll be nothing about leaky gut with regard to autoimmune disease. This is the most important thing, okay? No mention of dairy with regard to multiple sclerosis or type 1 diabetes. Nothing about Roy Swank on MS. Nothing about toxicology-related PAMPs and DAMPs. So that's pathogen-associated molecular patterns and damage-associated molecular patterns. And there's chemicals that'll cause that. We don't have time to go in that now. But that stuff's worth knowing about autoimmune disease. When they talk about oxidative stress, nothing about iron overload, nothing about the work of Douglas Calatheresia Pretorius papers and the amyloidoidogenic clotting that causes and how that relates to dementia. And I give them lectures on all this stuff. The dementia theory of Jack Delatorre. Jack Delatorre's theory, his book Alzheimer's Turning Point, and my theory, neurovascular uncoupling, those are by far the two best theories of dementia. They're the best theories in the world, Delatorre and mine. There's nothing even close. If you study it, go ahead, you'll see. You'll see that I'm absolutely correct, and I've lectured on that, okay? On both of these topics. All right, spinal degeneration. There's nothing about my concept of ischemic spine. I wrote an entire book on that. Ischemic spine is the most common cause of back pain. And it's not just, there were some papers in the 1980s on ischemia related to lumbar degenerative disc disease, but I explained that it includes everything. OPLL, DISH, OLF, all the way from not just the sacrum and the lumbar spine, but all the way up to the skull, okay, cranial cervical junction. Also, I go into the issues with F- and GP and scurvy related damage to collagen, causing essentially the same sort of degenerative disease. So anyways, here's the point. So yeah, I say the medical textbooks stink because I've had a lot of time to read through these things. I knew them pretty well when I was young. My kids are grown up. My wife works a lot. I just sit around reading these books and I'm like, holy crap, these books are totally wrong. No wonder all these doctors don't know what they're doing. And these are easily to be fixed. Watch my videos, start reading the scientific literature. Doctors have high IQs, but most of them don't read outside their own field what they need to know. Then they get older, they go to bogus CME, and they're just too exhausted. They want to just spend some time with their family and get some sleep. They work them into the ground, most hospital and clinical places. So anyways, there it is. Medical textbooks are a joke. And what that means, Mr. Patient, you're kind of on your own. But here's the good news. Most things are improved by low-fat, low-sodium, vegan diet. Oh, the other thing these books never talk about is the benefit of religion. It's like, oh, you can't say religion's good. Yeah, religious people are far healthier than non-religious people, okay? Low-fat, low-sodium, whole food, organic vegans who get their sunshine, who exercise, who spend time with their family, spend time with their religion. Those are the healthiest people in the world.